Welcome to the Rhode Island House of Representatives Committee on Health, Education, and Welfare. My name is Joe McNamara, and I'm chairman of the committee. Today is Wednesday, January 21st, 2015. Today we are going to hear several bills. That means that the sponsors will briefly explain the bills, and we will have members of the public that will come up and give testimony in favor or either pro or con with each bill. At this time, I would like the clerk to please take the roll. Here.
Representative Abney. Representative Ackerman.
Here.
Representative Amore. Representative Asinaro.
Here.
Representative Dan. Representative Corvese.
Here.
Representative Diaz.
Here.
Representative Fogarty.
Here.
Thank you. At this time, I would like to take a minute. We have several new members on our committee, and I'm going to just briefly introduce the members of the committee, starting with Representative Ackerman, who represents both Cumberland and Lincoln. And Representative Ackerman is a former councilperson in Cumberland, and this is her second term, I believe. Second term. She's a veteran on this committee. Representative Amore will be in shortly. He's in another committee. The vice chairman of the committee, on my right, is Representative Asinaro, who is noted in the State House as the man with the longest commute to the State House, all the way from Westerly. Representative Bennett is down on the left. He is an RN and a representative from Warwick. Secretary is Representative Canario, who represents three towns: Portsmouth, Little Compton, and Tiverton. Retired law enforcement official, and what many people don't know, he's also a DJ and very talented in that area. Representative Corvese represents North Providence. He is an optometrist with a practice in Johnston. Deputy Chair is Representative Grace Diaz of Providence. And congratulations, Representative Diaz, on your latest position with the City of Providence as a community organizer,
Senior Advisor on Community Relations.
Senior Advisor on Community Relations, and a great person for that job, and also a diabetes educator in the community. Welcoming new this year is Representative Fogarty of Wakefield and South Kingston. And Representative Fogarty brings a wealth of knowledge. She is a former, I want to say, president of the South Kingston Town Council, and has a background in pharmaceuticals, and is currently works in security for Textron. Raytheon. Oh, sorry, I named the competition. Wow. My colleague from Cranston, Representative Handy, is also the chair of the Committee on the Environment, a veteran. New this year is Representative Lancer of Cranston. Welcome, Representative Lancer, who is a retired chaplain in the United States Armed Services, the Navy. And welcome to the committee, Representative Lancer. Also new on the committee is Representative Malandano from Central Falls. She is a former town councilwoman with a wealth of experience, and kind of the second person on this committee had to have been a Peace Corps veteran. She served in Africa, and I'm sure that experience will come in handy on the committee. So welcome, Representative Maldonado. Representative McLaughlin is absent today. We are joined by veteran Representative Moran from Woonsocket, who is a Woonsocket firefighter, EMT, so that we're in very good shape on this committee should we have an emergency. New this year is Representative Price, who covers a large area, Richmond, Hopkinton, and Exeter. Welcome, Representative Price, who is a contractor, and a very interesting, Representative Price, you're also on the Historical Society? In Richmond. Yes. Very interesting. And one of our former colleagues, the late Leona Kelly, was responsible for our state stone wall protection statute. So you can bring some of that into the State House, the great preservation things that you people are doing. And with that, at this time, our youngest and one of our most talented new arrivals is Representative Regenberg, who represents the east side of Providence. Representative, welcome. And he is an administrator of after-school programs, a Brown University graduate, and certainly a young shining star in the House of Representatives. And Representative Amore has just joined us. Representative Amore represents East Providence and is a teacher at East Providence High School and former coach and scratch golfer. So with that, I would like to welcome the members of the committee to the 2015 session. And at this time, what we do very often to keep the bills alive within the bar of the committee is take a procedural vote that allows us to hold the bills in the committee and work on them so that we can amend them and take into consideration the testimony from the public. And we have one more representative that just entered the room, Representative Marvin Abney of Newport and Middletown. Representative Abney, welcome, and we'll have to pull up another chair. Well, you're a stand-up representative. So as I was saying, at this time, we are going to take a procedural vote which will keep the three bills we are considering today alive for our discussion and amendments within the bar of the committee. And at this time, I will entertain a motion to hold House Bill 5011, 5016, and 5046 for further study. That motion has been made by Representative Canario, second by Representative Diaz. All those in favor signify by saying aye.
Aye.
Thank you. Those bills will be held for further study. The first bill we're going to hear is House Bill 5011 by Representative Lombardi, who represents Providence, and I want to say the Federal Hill and part of Mount Pleasant. Representative Lombardi?
Oneyville and Valley Street, Mr. Chair.
Oneyville and Valley Street. Yep. Beautiful. Welcome, Representative Lombardi. Please proceed.
Thank you, Mr. Chairman, members of the committee. And, Mr. Chairman, I congratulate you for having divine intervention on this committee. I think it's certainly well needed in all government. But he's going to have to hold the...
That's well. We try.
Anyway... This bill, Mr. Chair, requires the Department of Education to provide professional development opportunities related to reading disabilities, including dyslexia. Certain teaching staff members will be required to annually complete 2 hours of professional development on screening and intervention for reading disabilities, including dyslexia. This would apply to kindergarten through grade 3 teachers. In November of 2012, Mr. Chairman, the Congressional Dyslexia Caucus was formed because of the injustices that are becoming apparent. When we start learning the facts that 77% of those incarcerated are 100% illiterate, and 85% of them, that was illiterate, by the way, and 85% of them are dyslexic. We pay approximately $110,000 for juveniles incarcerated, around $64,000 for adults. Not because I know it firsthand, Your Honor, but we pay a much higher price in the end for not providing early intervention. Many are taught by an education system that knows nothing of their disability and how they learn. This bill will address this. Early intervention, obviously, is a proven method to give the children tools early in order to succeed with less harm. It is our responsibility to ensure our teachers in our future that are given tools to address reading disabilities. Thank you, Mr. Chairman, and just please consider this. I think it's important.
Thank you, Representative Lombardi, and I love the fact that you start with kindergarten so the kids will get that early intervention. It's so critical, especially with the diagnosis of dyslexia or learning disabilities.
Well, it's your bailiwick, Mr. Chair. You've been in the education field your entire life, so you know better than anyone firsthand.
It makes a huge, huge impact. Are there any questions for Representative Lombardi?
Thank you, Mr. I'm sorry.
Yeah, Representative Handy.
A quick one, Rep. I really like the idea, but can you the stats you were saying was 85% of folks that are incarcerated are dyslexic?
In some cases, that's where some of the findings are. Yes.
Wow. Okay. Thank you. That was all I was trying to make sure.
Thank you.
That concludes the hearing on House Bill 5011. The next bill that we're going to hear is House Bill 5046, an act relating to insurance, health insurance. This bill by myself would prohibit a health plan and health insurance issuers from discriminating regarding the participation under the plan or coverage against any health care provider acting within their scope of license or certification. And at this time, I would like to introduce John Jordan. John, welcome.
We support the legislation because we feel that insurance companies should not be able to discriminate and develop different tiers of payment for the exact same services based solely upon the type of license held by the provider. The Affordable Health Care Act in our country has triggered a health care revolution. The manner and cost in which health care can be delivered must be changed to meet patient needs and provider shortfalls. The Federal Trade Commission in March of 2014 recognized this in a published position paper with regard to APRN utilization, which fully recognizes the impact and potential benefits of allowing APRNs to practice to the full scope of their training. Furthermore, the Veterans and Healthcare Administration is undergoing a change in the manner in which APRNs are utilized, and it will impact directly the health care delivered within that system. Full utilization of all advanced practice nurses, or APRNs, to the full scope of their training will help reduce costs in health care, relieve provider shortages, and reduce patient wait times. That is why this language was taken directly from the Affordable Care Act. This is not an Any Willing Provider Act, and we understand that different organizations can choose who may or may not participate. On behalf of the members of Rihanna, I would urge that you pass this bill. Thank you very much.
Thank you, Mr. Jordan. So Rihanna is the Rhode Island Nurse Anesthetists Association, Rhode Island Association of Nurse Anesthetists. And Mr. Jordan, for the members that were not here 2 years ago when we amended Statute 534.2-2 that expanded the scope of practice for nurse anesthetists, could you just describe those changes for them so we know what we're talking about? The button should be up, yep.
The changes that were made removed specifically the term supervision from all language pertaining to advanced practice, more specifically CRNAs, and replaced it with the word works in collaboration with. That opened up the scope of practice for advanced practitioners and allowed it to become more in line with the national standard and how CRNAs are utilized in the healthcare community.
Thank you. Are there any questions for Mr. Jordan? Representative Corvese.
Not for Mr. Jordan, and I do support the bill, but I was curious. I thought we passed something this years ago, and quite frankly, I thought it was members of my profession who brought this up. Okay, thank you.
Any further questions? Thank you, Mr. Jordan. The next witness is who signed up in support, however, is not speaking. Mr. Leonard Lopes is also representing RISNA and is in support of this legislation and will deliver written remarks to us at a later time. Mr. Sean Donahue of Blue Cross Blue Shield, Rhode Island. Welcome, Mr. Donahue. Please proceed.
Thank you, Mr. Chairman, members of the committee. As you mentioned, I represent Blue Cross Blue Shield of Rhode Island. This legislation has two fundamental provisions to it. Blue Cross Blue Shield of Rhode Island does not object to the first provision, which strikes the language that you see in red on the first page and replaces it by including certified nurse, registered nurse anesthetists. We do not object to that language. We have a concern, frankly, about the language contained on the next page that begins with C. And I'm going to apologize from the beginning of how complicated this is going to sound, but so this language comes from the Affordable Care Act. Senator Harkin included it in the Affordable Care Act, and the thought was that CMS Centers for Medicaid Services, would bring forth guidance for health plans to understand what non-discrimination means exactly. We got an FAQ, a frequently asked question, which is a directive from CMS telling us that, in fact, they would not be coming forth with directions for health plans to understand what discrimination will mean technically in the delivery of health plan services. And that was objected to by many of the folks in the provider community and also in the insurer community. And in the Cromnibus bill, the last bill that passed Congress in the last term, CMS was given an explicit directive to decide for all the states what discrimination means in this particular context. So they've been given a short amount of time to come up with definition, and they've sought input from not just the nurse anesthetists, but all the different provider communities, from chiropractors to behavioral health professionals, to get a national conversation going on exactly what that phrase, and it's a very important phrase, should mean in all the 50 states. So by way of background, we think that section, until the feds determine what the most important phrase means, which is the discrimination clause, we think that section would be problematic. I did have an opportunity to have a conversation with a representative of the nurse anesthetist, and we're both staying on top of this situation, and we're both willing to have an additional dialogue about coming up with language that reflects what the federal government does decide discrimination with regard to practitioners according to their license actually means.
So, Mr. Donahue, we're talking about the federal government coming up with a decision on something.
Right.
That sounds to me like something that it may not happen. If it doesn't happen, Are you prepared to come up with some other language? Because I think waiting for the federal government to do things just from a state perspective is not really an optimal option at this point.
Normally, I would have the same opinion of the ability for the federal government to get effective work done quickly. But in this case, they've been given a statutory directive in the last bill that passed Congress and said you will come up with the operational definition that turns these words into practice for all the health plans so that there's no discrimination from state to state to state, so that we can have one set of playing rules for all of the health plans and all the provider groups that is universally applied. I don't have a schedule, but I did promise the representative of the nurse anesthetist that I would dig into the bill granular level and find out when, in fact, they plan to give us that guidance, and then get back to your council with that information. And if it is not forthcoming, certainly we should act in the interim. But if they've given us a 60-day or a 90-day window in order to give us that guidance, we just wanted to make you, as the policymakers, aware that that is coming.
Okay, thank you. Are there any questions for Mr. Donahue? Yes, Representative Fogarty.
So you have not approached, you have not asked them what that definition is yet? You're saying from this point forward you're going to go, so it could be 60, 90 days? I'm just trying to understand the time.
Sure. We, when the language first was included in the ACA, we as an industry, through our representatives in Washington, did ask CMS for guidance so that we could operationalize the language. That's when they issued the directive to us that said, no, we're not going to be providing any further guidance on this particular issue. But both sides of the controversy went to Congress and said, we need direction on this. And that's the language that CMS has been required under the Omnibus bill that passed to come up with.
Any further questions for Mr. Donahue? Thank you very much for your testimony.
Thank you for your time, Mr. Chairman.
That's it. That concludes the hearing on House Bill 5046. The next bill that we're going to hear is 5016. What? If anyone has arrived late, we took a vote earlier to hold these three bills for further study. If you would like the record to reflect that you voted in favor of that, either for or against, if you could please let us know. Mrs. Cataldi, do you know who? Okay. Could the record please reflect that Representative Abney is voting in favor of holding those three bills for further study? Is anyone else? Okay. Thank you. The next bill we're going to hear is 5016 by myself. House Bill 5, excuse me 1 minute. There we go. House Bill 5016, an act relating to state affairs and governments, Department of Children, Youth, and Families. This act would eliminate the exclusive requirement that a candidate hold a master's degree in social work for the qualification of the director of the DCYF and allow for other degrees to be used to meet the qualifications. In addition, the experience in public administration would be qualified as demonstrated experience. Ladies and gentlemen, this came out of public conversations relating to the Department of Children, Youth, and Families, and precisely the position of the director of DCYF. For the past 5 years, this department has run at considerable deficits in the state budget. There is a letter in your folder from Sharon Reynolds Furland, House Fiscal Advisor. And just to go through some of this discussion, the department's contracts reported a deficit in 2013 of $2 million, after being provided an extra $1.5 million for the cost of out-of-state placements. In 2012, the department spent $1.8 million more from general revenues than appropriated, and this spending was primarily from overspending due to error on the department's part in budget cost and budgeting cost. It was a budgeting error on the department's part. In 2011, the department spent $3.2 million more than revenues for the reasoning, miscalculation of federal reimbursement. In 2010, there was a $500,000 deficit. The above information suggests, and I think this is important, that the department has consistent difficulty projecting and managing costs. First of all, to our friends that are social workers out there, having worked in education for 37 years, I realize the value of clinical social workers. They are an important part of our team, and our school social workers, the social workers that I worked with, I can tell you that they saved the lives of students. They had great clinical competences, they knew medication, they helped a lot of students. That being said, this position is an administrative position that requires more than just that clinical competency. And if you look at the bill, it also provides for advanced degrees, doctorates, and nothing would prohibit a governor from hiring a social worker. So the mistakes that have been made in the fiscal deficits that have continually gone on at DCYF could be, I believe, addressed by someone with a strong administrative background. And just to give you an example, in terms of education, for me it would be like saying any teacher could be a superintendent of schools, would be a good superintendent of schools just because they're a good teacher. Well, the fact of the matter is, to be certified as a superintendent in Rhode Island, you must, to get a superintendent certification, take classes dealing with school finances and school budgets. This is administering a multi-million-dollar budget and requires an administrator to have a background in that. Social work, being a certified social worker is helpful, but without the other credentials, I don't think it should be an exclusive requirement. And governors deserve discretion, especially in difficult times. These monies and cost overruns could be applied to different areas in the budget and actually benefit children through efficiencies in the department. And with that, we will, any questions for me, please feel free. Any questions from the committee? And we're going to start off with Sue, is that a P or not? Perlmutter? Perlmutter. Ms. Perlmutter, please proceed. And welcome. And for everyone, if you have written testimony, I would recommend that you hand the written testimony to the clerk. It can be admitted into the file, and that you just give us the highlights, and that way you get double credit because we read what's written, and then we get the passion of your statement here. So please proceed and welcome.
Thank you very much. Good afternoon, everyone. I'm Sue Perlmutter. I'm the Dean of the School of Social Work at Rhode Island College. At Rhode Island College, we train social workers to be both clinicians and administrators, leaders, in fact. My own degree in social work is one of administrative leadership. I've never practiced in a clinical setting. I tell you that because I fervently believe that social work is a really very important qualification for the director of the Department of Children, Youth, and Families. First, because social workers understand about the issues that the department faces, not only the issues of its budget, but the issues of the now almost 7,000 children served by the department. During the past 10 years that I have been in Rhode Island, the director of DCYF has not been a master's prepared social worker. So all of the issues that you describe with regard to the budget are not laid at the feet of a social worker. But they do represent some of the complexities that that agency must address. Unlike most of the states in this country, our Department of Children, Youth, and Families has 3 different major responsibilities. It's responsible for the care and protection of children who have experienced abuse and neglect. It is responsible for the juvenile justice system in the state, and it also is responsible for behavioral health care. Those are major and sometimes very separate issues. Social workers are trained to understand the complexities of the care of children, the care of families, the care of youth in distress, the training of those youth to be prepared to re-enter their communities, and they have training typically in behavioral health care. It is not that I believe that other administrators might not be able to do the work. It is that the social worker who understands children in the context of their families and communities, who understands what it's like to operate an organization and the constraints that are fiscal and administrative in nature. Social work offers a perspective that's very different from that of a person who has a degree in public administration, who does not really understand both sides of the issues that we are discussing. I won't take up any more of your time, except to say I would urge you to reconsider removing a master's degree in social work as a primary criterion for this position because of the needs of children and families, in addition to the needs for fiscal care and concern. I'm happy to answer any questions that you might have.
Is it doctor?
Yes.
Thank you, doctor. Now, when an MSW, if you're planning on going into administration, what would be, I have the course requirements for your MSW. If I was going into administration, what would you suggest? Or are there electives that people can take with accounting and basic public finance?
There are requirements that include courses in leadership and managing organizational change, program planning, budgeting, and finance. We have, and those are all required courses, and then there are electives that students can take that introduce them to human resource management and volunteer management and communication skills, so that we are working to develop the skills that students need to work in an administrative environment. In addition to that, our administration students do research that is program evaluation and needs assessment. They explore best practices in an area of content. So people who are interested in working within the child welfare system and in our macro or administration concentration are furthering both their content knowledge and their leadership and administrative abilities.
Thank you, Doctor. Any questions for Dr. Perlmutter? Yeah, we'll start with Representative Bennett and then Representative
Hi, Doctor.
Abney.
Thank you. The last directors, have they all had MSWs?
No, the last two directors have not. I'm not aware of the credentials of the directors before that. But Patricia Martinez had a bachelor's degree in social work, and she was not master's prepared. And Janice DeFrancis has her doctorate is in education. I'm not, and her other degrees are also in education.
Thank you very much.
Representative Abney.
Thank you very much for that impassioned explanation, and it was interesting to listen to. I think what I need to get a good understanding of is the difference between a person who has a bachelor's in social work and that of a person who has the master's in social work. It would help me because I want to make sure that what I'm not hearing is that you wouldn't want this designation to be changed because you only want social workers in the job. So if there's a difference between the bachelor's and the master's, that would help. It would be helpful if I could understand that.
The bachelor's degree is preparation for entry-level practice. And that means that our bachelor's degree students would graduate and be able to do direct service with clients. They may be the people who are staff members at DCYF would be examples of folks who graduate from our undergraduate program. They are oftentimes very skilled because they are not the 18 to 22-year-olds. They are people with great experience, but are only getting entry-level practice skills. People who are master's prepared have greater depth of knowledge and skill in working with clients one-on-one, but also in developing macro practice issues, in doing policy analysis, in designing programs, in looking at how to apply best practice in a setting where lots of different practices going on, but what they understand is how to use available evidence that a practice works. Whereas a graduate of our undergraduate program may learn about best practice, may practice it, him or herself, but they're not usually in a place to lead the uptake of such evidence-based practice for everyone.
That's beginning to be helpful because my concern is that you don't lead a department in a vacuum. I mean, there are budget constraints. There are those things that you have to be cognizant of, and I'm not convinced. Your explanation is very good, but if you have a person who simply doesn't have a social work degree, who's a good leader, and they understand that they don't understand all these things you're talking about, if they're surrounded by people who bring those kinds of issues to the forefront, you know what I'm getting at?
Yes.
What's the difference in the two?
So I've thought a lot about this, and what my own feeling about it is, and feelings of my colleagues about it, are that what you want in a leader is to understand that the work is bounded by these financial constraints, but that the passion and the belief in the needs of children and families That has to be at the core of the work. And that does not come if you don't understand the core of the work. It is like saying that we will bring in a person who has no child welfare knowledge, and that person will be dependent upon others to give them the understanding. It typically does not work. I have to understand it myself so that those very complex decisions about who gets the dollars, who gets to spend them, and what they get spent for have to make sense in light of that knowledge and understanding. It's not the dollars themselves. It is that children deserve and need to be safe. They need to have permanent families. They need to have their well-being increased through their experiences in the department. And that's not always happening today.
So finally, from your perspective in helping us, or in certainly helping me, you would suggest that we don't tinker with the qualifications at all, leave it exactly like it is?
I would very much appreciate that. It recognizes that the burden of care is in the hands of people who've been working in child welfare for almost 200 years, before there were formal child welfare systems.
Thank you.
So, Doctor, you would say that a person who holds a master's degree and or a doctorate degree and has demonstrated experience in child welfare and or child's mental health and or juvenile justice and public administration is not qualified?
I don't think that...
They don't have the passion? Because someone has a PhD in developmental psychology and a clinical practice, you can say they don't have, you said they don't have the passion that a social worker has?
I can say that because what I'm trying to explain to you is that the perspective of social work does not rest on one piece alone, does not rest on the child alone, looks at the child in a larger context and attempts to understand what is happening both in that context and in the child's life. A developmental psychologist is looking at the child's development. Educators are looking at the education of that child. Maybe they want to have the family involved, but they are not always seeing the child in the context of the family and in the context of the community.
Thank you, Doctor. Any further questions? Thank you for your testimony, Doctor.
You're very welcome.
Ms. Wendy Becky? Welcome, and please proceed.
Thank you. I appreciate all of your time today. I'm here testifying, like my colleague Dr. Perlmutter, to ask you not to change the law. I'm an associate professor of social work at Rhode Island College, was a social worker for many years in child welfare, was a foster parent for DCYF, and now have 2 kids adopted through DCYF. I care passionately about our child welfare system. I recently had young people in DCYF care into a class of mine on child welfare. One young woman had been in 19 placements. She was removed from her home when she was a young child, is now 17. She didn't actually understand how 19 placements could be better than being at home with a neglectful mom. She had been in foster homes, residential facilities, treatment programs, and now an independent living program. She had been moved for many reasons, most not of her making, although according to her, she acted out when she was younger, just stuff that most people don't get moved out of their home for. She described herself as someone who doesn't trust anyone and can't imagine herself as a functional adult. Many of the other youth who spoke to my class that night were nodding their heads. DCYF is filled with too many stories like her, too many young people who feel abandoned by a system that was supposed to protect and nourish them. I believe strongly that we need a leader who understands those stories before they need to be told. Someone who knows child welfare, who understands the intricacies and the nuances of the systems of care and the many placements and the communities in which clients live. We need a person who understands substance abuse and sexual abuse and domestic violence and child maltreatment and trauma-informed care. We need a director who knows what it means to have 19 placements in 17 years, who knows what it means emotionally and socially and behaviorally and spiritually. And yes, I couldn't agree more, we need a manager. We need a person who can motivate others to do more with less, to avoid burnout when a job feels really stressful, to provide guidance when decisions are difficult, to assure money is being spent in the right place. And we need a researcher, a person who is outcome-driven and will seek measures to determine success and plan strategy based on those measures. We need someone who has both extensive child welfare experience and excellent administrative skill. My concern is the way the legislation is written, with the addition you want to make, a person with a master's in public administration and no child welfare experience. So a person who has administrative skill in the area of transportation, for instance, would be qualified to come in and do this job. And I think child welfare and the kids in our child welfare system are just too important for that. I couldn't agree with Dr. Perlmutter more, that the person needs to understand this child welfare system well. Chair McNamara, I was interested in what you said about superintendent of schools. And I think an analogy would be, it would be like having an MBA come in and be the superintendent of schools without any education background. That's my concern here, is that the legislation doesn't mandate child welfare experience for the Masters in Public Administration because of the way it's written in at the end. So
I believe if you look at lines 4, 5, 6, and 7, hold a master's degree and/or doctorate degree and have demonstrated experience in child welfare and/or children's mental health and/or juvenile justice or public administration.
Yes, but the public administration comes and follows that with the semicolon. So it doesn't appear, the way the legislation is written, that the person would have to have experience in child welfare.
Well, I would disagree. Hold a master's and/or doctorate degree, comma, and have demonstrated experience in child welfare and/or children's mental health and/or juvenile justice. Yeah.
Right, and then there's the part with...
Yeah. All right.
So I hope that you will all hopefully not pass legislation that changes what is currently in place.
Are there any questions for, is it Dr. Becker?
It is.
Yes. Representative Regenberg.
Thanks. Just to clarify so I understand, are you saying that your specific concern is that it says and/or public administration, and because it's and/or, it means that it could only be public administration, you wouldn't need any of the others?
I'm concerned the way it's currently written, somebody without child welfare experience could lead the department that oversees child welfare, yes. And, you know, I'm a social work professor. I believe very strongly in the profession. So I would, of course, prefer that somebody have masters in social work. My concern, additionally, is the way this is written, yes.
Any further questions? Thank you for your testimony.
Thank you.
Lucy Burdick. Ms. Lucy Burdick. If you have written testimony, if you could hand that in, and please don't read it.
No, I don't have.
Okay. Please proceed. Welcome.
Thank you. Thank you for the opportunity to speak. Thank you, Chairman. My name is Lucy Burdick. I'm the current president of Rhode Island Alliance of Social Service Employees, Local 580, SEIU. I'm returning. 6 years ago, I was president, so thank you for letting me speak. I represent workers, social workers from the Department for Children, Youth, and Families. And I'm speaking on behalf of this bill that you would not change the bill and take out the MSW and the work experience. Having worked at DCYF in the past myself, I've been both a social worker and a supervisor for most of the 90s at DCYF. I can tell you that it is an incredibly difficult job. It requires advanced knowledge in a lot of areas, and that's one of the wonderful things about an MSW is that you become an all-around person. You have knowledge in areas that most people don't. You specialize in things like not discriminating against people, being aware of sexual gender identity issues, everything you need to know about children and their families and systems and resolving problems is the kind of knowledge you gain from an MSW or an undergrad degree program. So I don't believe that the budget problems in the last few years would be resolved by changing this bill. I feel strongly that the head of an agency sets the tone for an agency, and to require less of the person who's running the agency than the actual workers there, who require at least 2 years experience in child welfare, would be problematic. So do I think other people can run the agency? Absolutely, if they have special knowledge, if they have experience, if they have the kind of passion that I've had in my 31 years in state government for working with kids and families. So, you know, I would never undermine the position this panel takes. I would help to explain it, why you would want advanced degrees, why you would want special knowledge, why that when you're leading people who are dealing with the lives of children and what we used to call the capital punishment of families, the only agency that can effectively take apart a family, take a child away from a family and build a new family. It's that important to those of us who've worked there. We have plenty of MSWs who have business experience. There are colleges that have they have law degrees and MSW programs, Boston College. You know, we just don't want you to take that focus out of the bill. And I just want to make sure that you hear from someone who's actually worked there, who isn't helping out workers, representing them, who are working there currently, and who are very frustrated with what's happening, as much as you guys are. So.
Thank you, Ms. Burdick. Are there any questions? Representative Canario.
Mr. Chairman, the proposed legislation, as I read it, does require some knowledge and some experience to a degree in the social work field. Am I correct? It doesn't eliminate it completely.
It requires that they have experience in child welfare, children's mental health, and/or juvenile justice, at least 5 years of increasing responsibility, administering programs for children. The duties include, and not limited to, you can read those. So it gives the governor some discretion in hiring. That's what it does.
Thank you, Mr. Chairman, and that's exactly how I read the legislation. And what I do is I'm just trying to understand the testimony that's before us in terms of the you know, keeping it the way it is. I look at things such as a major hospital. Okay, you have a director of a hospital. That director is a doctor, but that director may not have experience in pediatrics, may not have experience in psychology, may not have experience in trauma, but yet he is an administrator of a hospital, but may not possess those qualities in those areas, but is a really good administrator. So I'm trying to compare this similar to that, because you have an administrator who does have experience or knows about the field, but again, they would surround themselves with people that have knowledge in those areas that would advise them, and that person makes a fantastic director. So I'm trying to take that scenario and place it here, and I'm having the difficulty understanding why that person would not be qualified if this one thing was to be changed. Because that person could be an excellent administrator, but may not have that master's in or doctorate in sociology or
social work.
Right. Yeah, the way I see it is, I would flip it. I would be, why would you not want someone with extensive knowledge in protecting children, families? Why would you not want them to surround themselves with good business people? So make the head of the agency someone who can speak to the workers, understand them, lead them in a way that they can speak with each other and understand what's going on, and then surround them with business people who can make decisions about contracts, about budgets. So you can find an MSW who's good at both. I would encourage you to do that, but to not make it the priority for this agency. We have struggled for years getting what I would call an ethical budget for DCYF. It's been underfunded. And then now with all the changes that are going on, you see that they've run into even more trouble. So I would encourage you to make sure that whoever you choose to run that agency understands the principles of social work.
Very good. Any questions? Thank you very much for your testimony. Mr. Robert F. Peck. Welcome. Please proceed, Mr. Peck.
Yes, Mr. Chairman. I'm Robert Peck. I'm a clinical social worker. I have a private practice in psychotherapy. I worked for 13 years for DCYF.
Excuse me, Mr. Peck. Is the button up on the microphone? Has to be up. And if you could move closer. Thanks.
All right. I worked for 13 years for DCYF. Most of the time, I worked in child protective services. I became a specialist in child abuse and eventually supervised 6 workers who were handling nothing but high-risk child abuse cases. I strongly believe that the director of this agency needs to be someone who is a social worker who's going to understand things like what trauma does to a child, and how do you evaluate whether parents are able to care for children. Ultimately, decisions about a family, about whether a child is removed or remains there or has some specialized kind of care, ultimately that director is responsible for those decisions. And when that director is deciding where the money is going to be allocated, he needs to know what the impact is going to be on the agency's capacity to meet those needs. Deciding that a child needs to be removed is extremely difficult. It requires that the social worker evaluate the capacity of the family to safely care for a child. Has to be able to look at their personality, what their issues are, what their strengths are. Has to be able to determine what happened to the child, what's gone wrong, how much harm is being done. And then decisions need to be made about whether that child has to be removed. Are there resources that can help this family become good caretakers if they're not now? In which case you might be able to leave the child at home. But if there is no resource, then you have to decide whether that child will be so harmed that he can't stay there. If the child is removed, it needs to be to a foster home or to some place that's going to provide good care. How do you recruit those resources? The new director will have to understand how do you what makes a good foster home? How do you recruit good foster homes? How do you create a network of strong foster care? Those kinds of skills, that kind of understanding, is ultimately the director's. If he chooses good people to work in the agency to carry things out, ultimately he's the one who knows that they're good because he knows that they understand what needs to be done. You can't tell somebody to do something if they simply don't know how to do it. You can't tell someone to ride a bike if they don't know how to ride their bike in the first place. It isn't going to work. These kinds of issues are understood best by a clinical social worker, a master's level social worker. The financial issues, that I agree with the previous speaker, is something you can get by advisors. But he needs to know if he cuts here, what is that impact is that going to have? What difference is it going to make if there are 10 fewer social workers, or if there are 10 more social workers? What are they going to be able to do? What will happen to children if they don't fund certain kinds of programs?
Okay.
It can be, well, I'm talking about the impact of poor care and trauma and what a social worker needs to understand. Well, let me leave it at that.
Yeah, thank you, Mr. Peck. Are there any questions for Mr. Peck? Yeah, Representative Bennett.
Mr. Peck, do you have other, in DCYF, they have other directors, right? Like a hospital would? Well, I work in a hospital. We have director of
Like
nursing,
vice president type.
I'm sorry?
Yeah, in the DCYF organization, there are directors, I believe. I haven't been there in 30 years.
Yeah, I'm sorry. I thought you weren't. Maybe I should ask Lucy that.
There are departments.
What I'm saying is the administrator has resources that people specialize in, you know, like placement, abuse. I don't know if DCYF cuts it up that way like a hospital would. But the question was brought to the committee about how an administrator runs the show, which is true. Basically, it was where they get your money. But we have the director of nursing, director of social worker. We have all these directors that direct these specific departments. Is DCYF? You can't speak for DCYF. You're not there, but it would seem to me that the administrator is the figurehead, and the rest are the workers.
Well, ultimately, I would expect that he has an understanding of what happens to a child or to their family if something isn't done or if something is done differently, because ultimately the decisions are his. He may delegate carrying things out. He may delegate the process of doing the research and figuring things out to somebody else, but ultimately the decision is his. And if he isn't sensitive to what can happen to a child, multiple placements were mentioned earlier. My stepdaughter adopted a kid from DCYF. The kid had 4 placements by the time he was 4 years old. He spent the first 2 months in Bradley.
Well, thank you.
That kid was terribly traumatized by his experience.
I feel your emotion. I adopted a little girl. It took me 5 years to get her away from her parent who was an abuser. So I can feel your pain. But on the level of an administrator, I would think that he would use the social workers or be a social. This bill does not eliminate the possibility of an MSW becoming the administrator. I guess it's a government appointed. I don't even know how that's done. But the governor may appoint the director. I would think that's how it goes. It'd be wise to appoint an MSW, but it would also be wise if a psychiatrist wanted it, or it's a matter of who's going to work good with the governor. But as far as working with the people, the social workers know all the placements. I mean, as far as Florida to California, they know the signs and symptoms to look for. When you walk into a home, you can look around, see how much food's there, if the house is clean. I don't want to drag this out, but I just don't see why you're limited it to a master's of social work when there's other master's degrees out there, and even doctorate degrees, that could use the staff
but
of social workers.
They're not going to understand the system. They're not going to understand the process. They'll understand, okay, this is what you can do to sell cars. I mean, if you set up a sales organization, this is what will encourage people to sell cars.
Yep.
But they're not going to understand what helps a social worker to do the job well, what the requirements are for a child to be secure and safe.
Right. We understand that point. Any further questions? Thank you. Thank you, Mr. Pick. Thank you for testimony. Lexi Mobarak is here from Providence College. She is a bachelor's in the social work program, and she wants to be recognized that she is in opposition to this bill from a bachelor's degree in social work student from Providence College. Thank you for coming tonight and expressing your opinion. Last witness, Mr. Rick Harris from the National Association of Social Workers in Rhode Island. Mr. Harris, please proceed. Welcome.
Is it on or it's on?
Up. When it's up, it's on.
Got it. You do have my written testimony along with child welfare standards put up by NASW. It should be helpful. I can actually help answer several questions here. First, Representative Bennett, what you described isn't quite the way it's structured. Dr. Perlmutter, if the committee wishes to bring her back up, can talk about that. I'm not familiar with the internal structure at DCYF. Also, in response to another statement, if a hospital's administration, I hope they're a doctor and not some other thing. I hope the Commissioner of Education is an educator first. I hope the Department of Health is a doctor. I'd hope that the Chief Justice is trained as a lawyer. I don't see any difference here. Child welfare came out of the professional social work. That's where it came out of. And so to eliminate that as a possibility is the same as eliminating that as a possibility of everybody else I just described. My testimony, I'm not going to go in detail because it's very long. So what I'm going to do is go through each section. I'm just going to mention this section, a little bit tidbits, and then move on. First, if you look at my testimony is developed, there's 6 sections here. The first is talking about my specific qualifications to address this particular bill and my vast experience in many areas. I'm a social worker. I'm a licensed independent clinical social worker, but I've also been an administrator since 1983. I've taught administration as an adjunct professor at Rhode Island College. We do go over budgets. We go over a lot of other things too. And the one thing you got to remember about a social worker, they're trained in what we call micro and macro. Every social worker graduates, according to the Council of Social Work Education, has to be trained in both those areas. So we're also trained as a values-based profession. We hang our hat on it. We'll lose our license if we don't follow our values. We have one of the most stringent code of ethics there is in the whole world, and we're bound by that. Every social worker is bound by that legally. Those are some of the aspects. So in every program I administrated since 1983, up to budgets of $25 million have finished in the black. Not one ever finished in the red. And so I love administration. My concentration in my social work program was in administration. And I've done that, but I've also done many, many hours of clinical services. Even as a top administrator and a vice president in a large mental health agency, responsible for community support services for children and families, working at 450 at-risk families a month, I never stopped not doing some direct service in that area. Because the connection, if I lost that connection, I would never be able to administrate that program appropriately. So anyway, the first section is about my unique qualifications, also as a certified vocational evaluator, certified job placement out of something college. And so I've had a keen interest in basic qualifications. But this bill is about basic qualifications. It's not about what people learn afterwards and all those years of experience. That's what you hire for. That's what you're looking for. This talks about what is the basic qualification. And of course, you can tell by now that I'm in opposition to the bill. I believe it as it is. So I'm uniquely qualified because of vocational work I've done and the other areas to speak to that basic qualification, which is what is Section 2 about. Section 2 looks at the Federal Department of Labor labor standards, uses the dictionary of occupational titles, to ONET, and those kind of things to demonstrate the basic qualifications of a position like this one, even though they don't specifically talk about that. They look at worker aptitudes, skills, knowledge, experience, and attitudes. And they also divide a job into data, people, things, and the skill levels required in each one. I provided that analysis for you. That will be in Section 2. Section 3 looks at the basic MSW education requirements. I talk a little bit about that. I actually give you the coursework. that's involved both in what we call a micro or clinical track and what's required in an administration track. I'll hold that up against any other administration side degree where you get something else, but you also do administration. Section 4 looks at historical factors. You may not realize how long social work has been around, since about 1840, starting at Dorothea Dix, whose direct advocacy around the mentally ill ended up in Butler being opened up in the state in the 1850s, and other avenues. Also, Wilbur Cohen. He helped draft the Social Security Act and was the major architect behind Medicare and Medicaid. These are social workers I'm talking about. Wage and hour, the 40-hour work week, Representative Bennett, I know you're interested in this stuff, and the minimum wage, that was established by Francis Perkins, a social worker, which he led the Department of, and I listed a whole bunch of people. I'm not going to go through them. I told you I'm briefly talking about each one. So to discount, the social workers aren't involved in policy. That's all I've done, almost exclusively for the last 12 years, is policy analysis, testimonies, and I taught policy analysis in 2 colleges as a social worker, as a licensed clinical social worker, by the way. A few comments on DCYF operations and leadership. You haven't had a social worker, as been mentioned earlier, in there for quite some time. I don't know if the previous ones, I don't know about it. If you chose a wrong social worker, you choose the wrong social worker. That's what the vetting process needs to be cleaned up and better at. Choosing the right social worker or the right related degree, although if I was king, I would require a social worker. But that's not what I'm after today. Also, I firmly believe that it's far too complex to lay it at the feet of one director. There's political influences that have occurred throughout. Several administrations here have had a direct responsibility for this headache we have now around budget deficits. Mental health has been flat funded, level funded, or worse, cut. We once had the best mental health system in the country. We're way down the ladder now. That's by the Ralph Nader study, by the way. We've always had issues looking at mental health for kids. I didn't question whether it actually should be in that department or not, but that's not my choice. But there's other things that we have done and cut and cut and cut. We've removed the safety net. When you remove the safety net, child issues like abuse and stuff goes up. Every study will show that. The last area is the standards that NASW have developed that help guide all these areas. So to say that social work is not involved in the operations of how DCYF works and everybody else is wrong. And we have standards for our code of ethics. We have standards for child welfare. We have standards for cross-cultural training. We have a mandate and a license for that. We have mandate and ethics and so on and so forth. So I'll let you read this. Please take time to read it. It took me a long time to write it, and a lot of research. And I hope you read every single word of it, please. And I urge you not to pass this bill, to leave it alone.
Yeah, Mr. Harris, just mentioning the standards, are you suggesting that other professionals, a psychiatrist that does not have a degree in social work, does not have standards, does not have ethics?
No, I'm drawing a link between child welfare development and our standards. They don't have standards around child welfare development, I bet. No, every profession has strong teachers. I know that very well. I was a director of the alternative school in Massachusetts, a public school. I'm very familiar with the standards of teaching and other professions, and they're very important, and they all guide what they do. Our standards look also at systems theory and micro theory at the same time, and we were child welfare.
Now, it's interesting, Mr. Harris, the last director who did not have a degree in social work, and speaking with social workers, she was commended by the social workers for her intervention program and dealing with some of the trauma, the post-traumatic stress that our social workers endure, and it was certainly very cutting edge. But yet, she did not have a degree in social work.
She met the standards of the law, though.
Right. So the question is, should we eliminate people that have doctorate degrees, the experience in administration with children welfare programs, simply because they do not have a degree in social work?
That's not what the law states, though. The law states have a related field, and that's what that person had. I told you what my personal advocate, but that's not what I'm professionally saying here. I'm saying leave the law alone.
Okay. Any questions for Mr. Harris? Representative Handy.
Thanks, Mr. Chairman. And actually, also, if I could ask if the legal counsel wouldn't mind looking at the language. You've said "and" public administration as opposed to "and" or. And I think if we wouldn't mind getting an opinion maybe at some point, because it sounds like your intent was "and," not "and or." And I wonder if we ought to check that language.
No, I think and or. I believe that the governor, when you have a department that has had these consistent overruns, that the governor should have discretion. And with the rest of the language, it's very clear in terms of the experience, the director's duties. I believe that you have to have faith at some point in that governor's discretion.
Sure, and so the reason I bring it up is because I think some of the witnesses' concerns, it is at least feasible that you could have somebody that has zero experience above it when you say "and" or grammatically, but maybe legally that's not the case, and that's why I was curious about that, because I know Chairman, you'd said it that way, and I wanted to make sure that I was clear on it, at least prospectively. But I wanted to thank my constituent Rick Harris for coming out tonight. I'm happy to see him here, and to your comments about a doctor, for instance, running the Department of Health or a hospital. I know Rep. Canario, former police officer, also might appreciate too. I would say you wouldn't expect a police department maybe to be run by somebody with just an MBA degree with a specialization in security or something like that. You'd expect them to have some experience in police enforcement along the way. But I was curious about your experience with DCYF and things like that over the years, or similar agencies, and the importance of the leader, that person at the top, and sort of how they lead that agency, and their philosophy sort of reflecting that along the way. I actually do think potentially somebody with that MA study, but I should say somebody with a related thing might make sense, but I do have some angst that we could roll in the wrong direction if we don't at least push toward that.
I had the privilege to run an independent living program as one of my mini programs which is 18 to 21 kids looking at being released from DCYF. And that's also was experience cut of that program at the time. I don't remember who was the director at the time. I can tell you if it was an astute social worker, that program would not have been cut. After kids being night-to-night placement for all those years, being put in foster homes multiple times, is the 18 to 21 child that we got to prepare to be an adult that never was. And that's so when I was talking about my experience at DCYF, it's actually on the ground level mostly. I also wrote DOS assessments, so I went in the families for DCYF. And that's diagnostic assessment services to determine what's necessary out there. I can tell you one thing, there's never enough stuff out there for those kids. And so when you look at the ground-up swell of lack of resources, it's going to go right into the department and cost and out-of-state placements. There's a direct connection there. It's a pipeline for the more expensive services. It's the same if we don't have good primary health care. They go to the emergency room. There's the cost. It's the exact same process.
So just what you're saying is, for instance, somebody without that sort of bigger picture experience along the way might wind up cutting here without really thinking about that as consequences, because somebody said, well we can save $500,000.
I'm not saying there's not people out there could do that. Every position has basic qualifications to apply for that position, and that's where I'm keeping it. However, I'm not saying there's somebody out there that can't do that. And after that, I actually suggest there's a potential, if you went through all the candidates, that you look at a waiver program on something like this. But it wouldn't be, I would leave the language in there to help ensure that you get that kind of sort of people applying for the position. And that's the best I can answer. I'm not saying there aren't people. I've always hired people that might be outside the realm of but I have a justification for it and stuff like that. And this one, right now we may have, I know we have a very friendly committee here, very friendly chair who understands kids very close. We have a governor that I think believes in that. What's about the next governor? You change this, it's never going back. And you can have a totally different experience here, where you can be putting people that would not be qualified in there. I really, truly believe that. I wouldn't be here if I didn't believe that.
Any further questions? Thank you.
Thank you very much.
Thank you, Mr. Harris. That concludes the hearing on House Bill 5016. At this time, I'll entertain a motion to adjourn.
So moved.
Representative Zanaro moves we adjourn. The Rhode Island House of Representatives Committee on HEW is adjourned for the evening. Thank you and have a nice evening.